Hi, welcome to Dr. Brainwaves. I'm Dr. Rena Azar, and today I'm going to talk about tinnitus. Tinnitus affects about 15 to 20% of people. It is feeling like you have a swishing in your ears. It can be a swooshing, a clicking, a buzzing, a humming. It can be constant. It can be off and on. It can be something that comes and goes. It can be in one ear or both ears. And that is often called ringing in the ears. That's what people usually call it, but it is technically called tinnitus. So tinnitus is common. It can be something that is transient, but the question is, when do you need to come in to be seen and evaluated for it? So I think one of the reasons that I like to do these series is so that you know why you should come in, because oftentimes if you know why, you'll understand when it's important to come in and be more motivated to be evaluated for a problem such as this. Tinnitus is a problem that can arise from many different things, including just normal age-related changes in the ears. It can be something that results from a history of loud noise exposure. It can be from tumors in the brain or the ear. It can be from damage to the ear from a stroke or ear trauma or injury. It can be from something that we call a high flow state, which is when the vascular system, the blood vessel system, is pumping blood through very rapidly. That occurs often in anemia. It can occur in thyroid diseases where people are hyperthyroid and the heart is increased in its activity and is very pulsatile. It can be a result of neuropathy from diabetes or changes in the nerves from diabetes, Lyme's disease, multiple sclerosis. It can result from abnormal blood vessels. It can result from what we call arteriovenous malformations, which is a fancy word for saying abnormal blood vessel development, flow, areas where there's large dilated blood vessels where they normally should not be. In addition, infections, of course, can cause it. Ear infections, sinus infections, syphilis can cause tinnitus, Meniere's disease, TMJ, and these are some of the many things. These are actually a list of most of the things that can cause tinnitus. So why do you need to come in? Because we want to make sure you don't have any of those disease processes going on. And we also think it's important because we see that frequently people develop severe anxiety and depression. We like to rule out treatable causes, not just severe underlying causes for ringing in the ears, but we want to make sure that we identify treatable causes for tinnitus. Frequently, we don't always find a cause, but we have some things that we can do to treat it, which we'll come to shortly. Treatable causes include certain medications which can cause ringing in the ears. These can include some antibiotics, some chemotherapy agents, also aspirin and anti-inflammatories like ibuprofen and naproxen have been known to cause ringing in the ears. And we also know that early changes that cause hearing loss can give ringing in the ears. So when you go to see your doctor, what would you expect? Your doctor is going to evaluate you because sometimes it's as simple as wax in the ears. That's a pretty easy cure. And if it's a medication, it's usually as simple as identifying that medication and stopping the medication. The doctor will evaluate the blood vessels around the neck area to see if there's an abnormal blood vessel there. They'll evaluate some neurologic symptoms, in other words, specific symptoms like hearing loss, any kind of numbness, tingling that might be related to a tumor growth. In addition, the doctor will usually determine that they'd like to have you do some audiology testing. And that audiology testing will check multiple things about the tinnitus, which includes how much do you have, how loud is that ringing, how much sound does it take to overcome the type of ringing that you have in your ears. In addition, obviously, they'll determine if you need to do CT or MRI or some type of imaging to look for tumors, which are treatable, but more importantly, something that we need to identify and keep from these tumors from getting larger, causing more problems, and obviously identify malignancies because many tumors are not malignant per se. And also look for underlying abnormalities in the vascular system, the blood and heart vessels. 90% of people that have ringing in the ears have some degree of hearing loss. So in an ongoing basis, your doctor will be advising you about how frequently to do testing, usually yearly, to make sure there's no progressive increase in your tinnitus and, more importantly, in your hearing loss. Things that are very important to come in to be seen for are if your tinnitus or ringing in your ears rather is unilateral, one-sided, if it's pulsatile, if it's preceded by symptoms of infection such as fever, nausea, vomiting, if you have visual changes or dizziness. Those are reasons that you need to get your ringing in your ears checked out very soon. And what do we do to take care of tinnitus? Other than identifying underlying causes that are treatable, like thyroid disease, perhaps hypertension that gives a high flow state, anemia might be corrected. Other than correcting those, we're left oftentimes with people who have ringing in the ears with no identifiable cause or absolute cure as far as eliminating the underlying cause. So besides stopping medicine, removing wax from the ears, some of the things that we do for people with ringing in the ears are counseling with cognitive and behavioral therapy to learn how to block out the sounds, to learn how to habituate. That's a very fancy word, but it really means that we recognize that people oftentimes will block out sounds from surrounding noises like an air conditioning unit or a refrigerator. We can use that same habituation process to get our brain to be accustomed to the ringing in the ears if it's a situation where we're not going to be able to get rid of it. Sometimes we do things to augment hearing, to improve hearing, and that will help to block out the sounds of the ringing in the ears. That can be hearing aids, or in somebody who has severe hearing loss, who has cochlear implants or could use cochlear implants to improve hearing. Those are methods that we use to decrease the effect of the constant ringing in the ears that is very problematic and anxiety provoking for people. There are some devices that we can use to desensitize, which is a little similar to habituation. And sometimes we resort to antidepressants and anti-anxiety medicines to help people to deal with the frustration of the ringing in the ears. So we have a lot of different modalities to treat it. We do like people to come in and have it checked out. There are some preliminary things that we might do, like looking in the ears, following blood pressure, some blood work, depending on what other symptoms you might have. But it is something that we would like to evaluate for underlying causes that are potentially severe, and for treatable causes to prevent the frustration and anxiety that comes along with a constant ringing in the ears. And there's also a lot of behavioral and cognitive treatment that we can do for that as well. So thank you for visiting Dr. Brainwaves as we discussed tinnitus or ringing of the ears.